Graphene. Remember that name because we're going to hear a lot about it in the future. But what is graphene? Well, it's the thinnest material in existence. It's so thin, it only has 2 dimensions. That's something mainstream scientists at one time thought was simply impossible.
The fact that it's a 2-dimensional material is striking in that by a 2-dimensional material we mean, thinner than thin. And so it could be, the thickness could be 1 or 2 layers compared to, essentially an infinite scale in terms of the planar direction. And so the ability to make this at all was shocking. And now the fact that graphene can be made, by a 10-year-old with a pencil and Scotch tape is just mind-boggling.
What? You can make it with a pencil and Scotch tape? Well, that's exactly how it was discovered. Scientists at the University of Manchester were working with graphite, the stuff pencils are made of, and they wanted to make the material thinner. So they stuck some Scotch tape to it and peeled it back. Sure enough, every time they did that, the layer got thinner, until finally they were left with a material only 1 atom thick, in a hexagonal shape. It was hailed as a wonder discovery, and the 2 scientists who found it won a Nobel Prize in 2010. But despite all the ensuing hoopla, no one could seem to figure out what to do with it.
We're really at this point where we're past the sort of wow stage of, I can't believe this is even happening, and now moving into the oh my gosh phase of why is this so difficult to make something useful out of it.
Scientists first saw it as a way to replace the silicon chip. Graphene conducts electricity 250 times faster than silicon and can carry data 30 times faster. But it can't turn on and off to allow for the ones and zeros in computer code like silicon can. No one has yet figured out a way around that obstacle. But it has another property that could turn out to be a breakthrough. Unlike silicon, graphene can conduct heat.
Often one of the challenges in electronics is not just how quickly you can transmit information, but as you get smaller and smaller, how you're going to do that and not have too much heat that can destroy the device. And so getting heat out of a system can often be just as important as transmitting the electrons that carry the information you're talking about. And so the potential for impact in electronics of graphene has been seen since its discovery and once these properties were realized.
So you could add a layer of graphene to silicon to pull away heat, which would allow silicon chips to get even smaller. And now graphene is being used for a much different purpose. At the Joint Department of Biomedical Engineering at the University of North Carolina, Chapel Hill and North Carolina State University, researchers have discovered a very promising use for graphene as a cancer drug delivery system. It starts with 2 cancer drugs. The first is actually a naturally occurring molecule called TRAIL. When it attaches to cancer cells, the cells spontaneously kill themselves. TRAIL works best when it sticks to the outside of the cancer cells. Another drug, doxorubicin, called DOX, works best on the inside of the cell. Researchers attach each of these therapies to 1 layer of graphene. It especially sticks to DOX because they're built alike.
If we look into the structure of the graphene, it's hexagon-based. Okay.
Right, like a chain link fence.
Exactly, and this one also have this kind of benzene group. Okay, hexagon-based structure.
So very similar structure.
Exactly.
To the graphene.
Exactly, and so then once they come together, we create like a pipette stacking effect. They will come together and with very high affinity.
And like a flying carpet, graphene moves through the bloodstream and delivers its payload to cancer cells. Thanks to graphene, the TRAIL stays on the outside. The DOX is absorbed inside, and bam, they destroy the cancer cell. So it's a 1-2 punch.
You are right.
So you used it in laboratory rats. What was the result?
Yeah, actually it's very promising, and we use the lung cancer model as well as like a breast cancer model, and they show that they can significantly inhibit the tumor growth compared to the control groups.
In fact, it worked much better than either drug given separately or even both together. The secret is that graphene allows trail to stay out and docks to get in, something that couldn't be done without graphene. The next step is more research that can lead to trials in humans. And researchers say graphene could be used in other medical applications as well.
You can also take advantage of the unique, optical property of the graphene, okay? Then potentially do some bioimaging. The graphene can emit some super infrared lights, okay? So that means you can, potentially for this kind of non-invasive imaging, okay?
Graphene does emit infrared light as well as visible light, making it a candidate to replace conventional lighting. Graphene has another captivating property. Although it's nearly invisible and weighs next to nothing, it is airtight. You could make a raft out of it that would be unbelievably lightweight. And it's rubbery. There's talk of making electronics out of it that could bend like a foldable phone. Clearly, this wonder stuff has incredible potential.
So you've got the biomedical application of graphene coming out from the biomedical engineering department at the same time that we have multiple departments working together trying to build up our expertise in carbon-based electronics, which could be graphene or could be other forms of carbon.
Amid all this research, Professor Gu came up with this latest medical invention, not using graphene, but using another nano-sized tool. It's a miniature patch for diabetic patients that delivers insulin painlessly and can sense how much insulin is needed. These itsy-bitsy breakthroughs show clearly where the newest scientific frontier is headed, to the microscopic world of atoms. And North Carolina researchers peering into this tiny world are discovering big advances in science.
We work together across departments, and you never know where the next big breakthrough is going to come popping out.